From unexpected tattoos to removing the wrong limb, today we look at 9 crazy things doctors have actually done. Number 9. Lost and Found. We've all seen movies or television shows where bumbling doctors leave items inside of patients leading to hilarious results. But unfortunately, these cases actually have basis in reality. There are over 1,000 cases every year of this happening. But in one particular case, the patient suffered more than just physical damage from an item being left behind. Dariush Mazari was 74 when he went for surgery at the University of Pittsburgh Medical Center Presbyterian to have a shunt installed in his chest. Everything seemed normal afterwards, but for 2 years he felt increasing pain in his abdomen and went back to the medical center several times, insisting there was something wrong. Where the story gets really outrageous is that instead of believing him or running any tests, the doctors brushed it off as being a psychological problem and told him to seek psychiatric care. Finally receiving a CT scan from another facility, it was discovered that he had a 10-inch long metal retractor left inside him during the operation. The device was removed in a subsequent operation, and Mazari's pain, which had become almost unbearable, was finally relieved. He promptly filed a lawsuit against the hospital, and the two sides reached a settlement outside of court. Number 8. Physical graffiti. When dentist Dr. Leanna Getz went in for a cesarean section, she got what she had hoped for, the birth of a healthy baby girl. But she also got more. When resting in her recovery room, she decided to look at her scar in the mirror. But what she saw next to the scar was horrifying. The letters A and Z had been cut into her abdomen. The A and Z were the initials of Alan Zarkin, the doctor who had performed the procedure. This was the last thing that Dr. Getz expected to see, as she and Dr. Zarkin were more than just patient and doctor. In fact, Dr. Zarkin was a friend of hers who she had invited to dinner with her family on several occasions. Dr. Alan Zarkin had been known for his flamboyant, holier-than-thou demeanor. But this incident was extreme to say the least, and he was immediately suspended, leading Dr. Zarkin to resign soon after. Dr. Getz filed a lawsuit, and Dr. Zarkin's defense was that he was suffering from a type of dementia. But the truth was, he had known about his Alzheimer's-like condition for months before the surgery. After 4 months in court, Dr. Zarkin was put on a 5-year medical probation and settled with Dr. Getz to the tune of $1.7 million. But no amount of money will make her forget the frightening branding of a demented doctor who she once called a friend. Number 7. Bank run. Some surgeries take several hours of intense work, so much so that the surgeon may not have time to run the errands they need to. But this is what surgeons sign up for, and most of them know that a patient's health comes first. This is not the case with Dr. David Arndt. In 2002, Dr. Arndt was in the middle of a grueling spinal surgery that could normally take up to 6 hours. But instead of the task at hand, Dr. Arndt's mind was somewhere else. Nurses reported that Dr. Arndt had been asking anxiously when paychecks were supposed to arrive. And when they finally did, about 3/4 through the surgery, he asked the check-delivering surgeon, Dr. Lee Troy, to take over for about 5 minutes, and then he bolted from the operating room. Apparently, Dr. Arndt needed to deposit a check into his bank account before it closed, and was gone for more than half an hour, being paged repeatedly before returning. Meanwhile, his patient lay unconscious with his back wide open on the operating table, unaware that his doctor had abandoned him. However, when the patient awoke, he found out that the doctor cared more about his bank account than his patient's spine. The patient decided to take it out on the thing the doctor loved the most and sued him. Needless to say, Dr. Arndt had his medical license suspended and his life spiraled even more out of control. Only a couple months later, he was back in court on drug and assault-related charges. 1 year later, Arndt was finally locked up for these and numerous other crimes. Number 6. Lady lumps. Alexander Bays was a successful bodybuilder. He was a runner-up in the Mr. Universe contest and former Mr. Mexico. One day, he decided that he wanted to artificially enhance his pecs with plastic surgery. So he searched around his home of Miami Beach for the right surgeon, and he came upon Dr. Reinaldo Sylvester. Dr. Sylvester had been practicing in the area for over a year and had performed dozens of surgeries. But on the day that Mr. Bays came in for surgery, the dark charade that supplemented his lavish lifestyle came crumbling down. During the operation, Bays awoke from the surgery to find that Dr. Sylvester had given him women's breasts. Going in and out of consciousness throughout the procedure, Bays also witnessed some of what a hidden video camera documented. Sylvester had used horse tranquilizers to knock his patient out and then carelessly cut Bays and shoved the crude implants into his chest. The hidden video camera was placed by another patient of Sylvester's, Jeanette Bernal, who had breast augmentation surgery that was botched so badly that she was permanently disfigured. When law enforcement found out about these surgeries, Sylvester was arrested, but then escaped to Belize. What the police uncovered was that Sylvester was not a doctor at all and had no license or background in surgery. Though only a few patients came forward, it is suspected that there are many other people who had similar terrifying procedures, such as Bays and Bernals. Known as the Butcher of South Beach, Sylvester was eventually caught years later in Belize, where he was working at a school of medicine and extradited to the United States. He was sentenced to 7 years in prison and sued for millions of dollars by his victims. Number 5. Double booked. A 67-year-old woman who in medical journals and the media is called by the pseudonym Joan Morris went into a teaching hospital for a cerebral angiography in order to have the aneurysm in her head studied. The series of mistakes and unfortunate events that followed could have cost Mrs. Morris her life due to an inexcusable mishap involving the fact that she had a similar name to another patient. Mrs. Morris had her heart operated on for an hour. The cardiologist was well into the complex procedure called an electrophysiology, which involves stimulating the heart with electricity to test its rhythm, before he realized he had the wrong patient. This was only found out when the doctor who was to perform the angiography went looking for her. The procedure was so far along that the cardiologist had already punctured an artery and inserted a tube into her heart. Though they were lucky to catch it when they did, what they already had done had put Mrs. Morris in unnecessary danger of complications such as infection, having a stroke, and internal bleeding. Mrs. Morris didn't suffer any of these in the end and surprisingly decided not to sue the hospital, perhaps being too altruistic, stating that at least she found out that her heart was healthy. Number 4. More for me. Ex-nurse Sarah Mae Casaretto was a real-life Nurse Ratched. When Larry V. King went in for surgery to have his kidney stones removed, he unfortunately received the drug-fiending Casaretto as his nurse and suffered greatly at her expense. Nervously awaiting his operation, his suspicions were slightly aroused when, though it was supposed to be a painless surgery, Casaretto told him to man up and take the pain because there wasn't enough time for more medication. King was confused, but not enough to stop her as she wheeled him to the operating room. So the surgeon began to operate, and King instantly felt the intense pain of a tube being inserted into his kidney. He tried to leap off the table, but was held down by a technician while Casaretto tried to hush him up. The doctor and assisting techs soon assessed that Casaretto was herself anesthetized. Upon searching her, they found that she had taken a large amount of the painkiller fentanyl, which was meant for Mr. King, and was extremely inebriated. Casaretto refused to take a drug test, quitting on the spot. She was arrested at a later date for felony theft of a controlled substance and struck a plea deal, resulting in a meager 3-year probation, to the understandable chagrin of King. Number 3. Evil injection. Dr. Stephen Pack was a married father of 2 who was having an affair with his coworker, pediatric nurse Joy Shepis, and decided to take drastic measures in order for his tryst to remain a secret. When Shepis became pregnant, Dr. Pack tried to convince her to have an abortion, but Shepis refused as she was vehemently pro-life, and even told Pack that she would provide for the baby herself. But Dr. Pack, who Shepis said had been acting strangely even before the pregnancy, was afraid that he would be forced to pay for the raising of the child and that his wife would divorce him if she found out. So Pack took matters into his own hands and stole 2 syringes full of the drug methotrexate. Methotrexate is a drug commonly used to induce labor, and that Pack knew would promote a miscarriage. One night, Pack waited for Shepis to leave the hospital and followed her into the parking garage across the street. He then proceeded to rush her, stabbing her 6 times in her buttocks and legs with one of the syringes. He screamed, "I'm giving you an abortion," and called her expletives. Pack fled, but eventually was caught and detained by the hospital security. The police took him into custody and charged him with weapons possession, assault, and the attempt to commit an unwilled abortion act. He pleaded guilty and was sentenced to 2 years in prison. At the time of the attack, Shepis was over 2 months pregnant, and despite the chance of the baby being irreparably harmed, she decided to go forward with the pregnancy, and the baby boy was born, fortunately without any dysfunctions, other than having a psychotic father. Number 2. Accidental amputation. Mr. Willie King, a longtime sufferer of diabetes whose condition was so bad that his doctor recommended amputation of his leg, had finally reconciled his fears and agreed to the procedure. His doctor, Dr. Ronaldo Sanchez, was a highly regarded surgeon and had performed amputations like this many times before. But on this day, a simple mix-up severely damaged his career and cost Willie King both of his legs. Because of a mistake on the blackboard in the operating room, the wrong leg was prepped for amputation, and Dr. Sanchez, who failed to double-check the leg, amputated the wrong one. Though it was ultimately his responsibility, several factors played into this equal parts ridiculous and horrifying scenario. First off, other than the blackboard being incorrect, the room schedule and the computer in the operating room also had the wrong leg. Second, Both of Mr. King's legs were so severely afflicted with gangrene that several doctors testified it would have been only a matter of time before the other would have to be removed. But without a doubt, it was Dr. Sanchez's medical duty to make sure that the right leg was removed. Mr. King eventually had the correct leg amputated and learned to walk using metal prosthetic legs. Dr. Sanchez was fined $10,000, barred from practicing medicine for 6 months, and given 2 years probation. Because of this frightening flaw in procedure and other similar cases, several laws passed that required doctors to take a time out and triple-check everything before even touching a scalpel. Number 1. Invisible cancer. Kim Tutt was 34 years old when her dentist found a lump in her jaw. Her doctors concluded that the lump was cancerous and told her that she had 6 months to live. They also told her that if she tried a radical surgery, that they would probably give her a few more months to live. So, of course, she opted in. The surgery that involved removing the entire left side of her jaw and replacing it with her fibula was considered successful. It was 3 months later when Tutt found out the horrifying truth about her cancer. She received a call from her surgeon, who revealed that she had never had cancer in the first place. Apparently, her biopsy was contaminated with another from the lab, resulting in her having a permanently disfiguring surgery without cause. Tutt was elated that she didn't have cancer, but mortified that her life had been ruined because of a mix-up. She has undergone several facial reconstructive surgeries, but will never look the same as she did before the unnecessary operation. Kim Tutt sued Robert B. Wells and Pathology Associates, who were in charge of the diagnosis, and was awarded $250,000.